Chronic pancreatitis is an inflammatory condition of the pancreas where the pancreas gets damaged because of recurrent attacks on it, and eventually it gets replaced by severe scarring and causes its function to go down. And these patients, they suffer from a severe pain, they require a pain medication. So what our program does is that we evaluate them and then evaluate from a permanent surgical resolution of this problem.
It came out of nowhere, and it was so debilitating. The first encounter, I waited at home because I'm a tough cookie, and I thought it was just a bad bug or something, and my body was in shock. I mean, that was trauma. I come from humble beginnings, and life hasn't always been nice, but that by far, pancreatitis was debilitating, and it shook me to the core, and then for it to happen again and again.
Many patients for the chronic pancreatitis, they require narcotic pain medications and conservative treatment over a long period of time. And these patients, they go from one hospital to another because not many surgeons can offer this treatment because it's very challenging both to offer and take care of these patients comprehensively. And if you don't operate on these patients, then they continue to develop a more severe scarring, more pain. Sometimes there is a risk of forming a cancer as well. And that's why there is a need for them to be evaluated properly and offer this surgery.
We came to Chapel Hill not knowing what they could offer me, not knowing what I was literally ignorant to it. I thought that I was just they were gonna put a stent in and I would come back and have it drain and life would go on. I mean, I was ignorant to even what the pancreas was until pancreatitis hit, and then I got very educated on that little insidious organ. Basically, your pancreas is dying. You know, the pseudocyst it's necrotized, and but there's a surgeon here who's looked at your records, and they think that they may be able to help you. And that was when I was introduced to Dr. Desai and Marilyn.
So ours is a very comprehensive program where we can evaluate and offer all these different type of therapies to the patient. There are not many programs in a country which offers this treatment, which we call TPIAT, that is a total pancreatectomy and islet cell autotransplantation. There are only a handful of that, and this is the only program in the state of North Carolina. The issue with this chronic pancreatitis and this type of program is that many programs will offer only the surgery without a cell transplant, and some who can offer only the cell transplant without other surgeries. Ours is a very comprehensive program. Because of the lack of programs like this, the patients will have to keep on be dependent on the painkillers and just going from ER to ER, whereas the programs like this can treat them and then they put back the great quality of life.
Meeting Dr. Desai, though, I mean, he came in and he spent a good hour with me. Not just the appointment starting, talking to the PA and Marilyn. No, Dr. Desai, when he came in, he spent time to explain to me what was going on and what they could offer me. And, you know, it's a 50-50. I mean, they couldn't guarantee me that my islet cells were going to take and that they would even have islet cells to take. But it was a gamble, and I had nothing to lose. I mean, my pancreas was dying. It was going to fail me, and I was going to become a diabetic.
Jill was suffering. She had a chronic pancreatitis with the pancreatic duct, which was disconnected. And she was also out of the work, having a pain, to take a pain medications. We took out the pancreas, give her islet cells back, and she did fabulously. Now she has a great quality of life. She's working again full time, and those are very important things for this patients.
Post-program, I mean, it was a little shaky. The healing process was, I think I did amazing. It's the mental toll. I think it's the mental toll of just having pancreatitis and then the mental toll of dealing with that type of surgery, because that's major.
You know, we started this program in 2018. We gradually built it up. Recently, in last November, we crossed 100 patients we operated on. The future is clinically, we want to reach out to as many patients of North Carolina as we can to help them out and to grow clinically the program. Along with that, we are doing a lot of good cutting edge research, and that research will help to alleviate some of the challenges of this disease and the surgical outcomes which will make it better?
Marilyn was wonderful. I mean, like I said, after Desai, told me what he could do, then Marilyn started you need to do this, we got to do this, put me on a continuous glucose monitor, gave me a FedEx, said in 7 days you're going to, she was just and I'm like that, don't sugarcoat anything, especially when it comes to my health and well-being. It was worth it. Like I said before, the surgery was a cakewalk. I've got a 12-inch incision, but I think I did very well. Recovery. Yes, it was worth it. I have nothing to lose. Like I said before, I was going to be a diabetic. Will I need insulin in the future? Maybe, but I don't now. So I try to hold on to that and just be thankful.